Welcome to Talking Sheik, everybody. We talk a whole bunch of chic with my colleagues and friends. Today, I have a very special guest, the top, and I mean the top dentist in Oklahoma City, Dr. Neeral Patel. He just opened a brand new practice here in Edmond, north of OKC. And Doc,
hey Sheik, how's it going?
How's it going, brother? Thanks so much for taking the time to sit down with me. So,
yeah, thank you.
What prompted you to get into dentistry?
So dentistry, I knew I wanted to be a part of the medical field, but the reason I like dentistry is because I get to connect with my patients. I get to sit down with them. I get to talk to them. I get to meet their whole family. I see patients from little kids all the way to the elderly. I get to see everybody and I get to spend time with them. I see them every 6 months, every 3 months, whatever we decide together. And so just sitting down and talking to my patients is what I enjoy.
That's amazing, brother. Was there anything in your life that inspired you to go down the direction towards dental practice?
Yeah, so dentistry played a role in my dad's life, and just seeing how he kind of struggled. When he was little, broke his front 2 teeth, and so when I was growing up, he had what we in the dental world call a flipper, the little partial that you take in and out, you can't really eat with or anything like that. He now has something a little bit better and can smile, and I saw the role his dentist played in his smile and changed his whole outlook on life, kind of. He was smiling more and things like that, and so just seeing that kind of geared me to kind of come into dentistry, and I was able to see what kind of changes I can make in people's lives, and so that's what really got me into dentistry.
That's amazing. It's true. Dentists really, play a vital role in all of our lives, and it's incredible that you started this brand new practice here in OKC so we can change more people's lives in the area. So what kind of things are you guys offering here?
So at this practice, we're offering a little bit of everything. We're offering the routine works, the smaller fillings and all that, but we're also offering the more exclusive things like implants, some wisdom teeth extractions, the clear liners, and things like that. And so we're open for just about anything.
Oh, so you guys are like full service.
We are full service. We see kids, we see adults, we see everybody.
So I think it's really cool. I think it's really amazing what you're doing here. And I kind of have some questions that I really kind of wanted to ask you. As a dentist, what's the biggest mistake you see people make when it comes to their dental care?
Yeah, so Sheik, with dentistry, one of the things I'm realizing as I am growing in my profession is that people just don't see the importance of dentistry, right? Our confidence, our everything starts with our smile. We wake up and we're looking to drink coffee or eat food, and everything starts with our mouth, but people just don't realize what effect our mouth has, and they take it for granted. And so I try to get patients to get excited about coming to the dentist, try to get them to realize the importance of dentistry and kind of show them that. And that's, I think, one of the things that is getting taken for granted nowadays.
I agree. It's been a while since I've been to the dentist myself. With that, what's something that people are not doing that they need to be doing every single day to take care of their smile? Because you're right, the smile is our confidence. It's everything, right? And everything does start with our mouth. So what's one thing you see that people are not doing what they should be doing?
Yeah, so as all dentists have heard, when patients come in, they claim they flossed or they're flossing every day, but we can kind of tell that flossing is something that gets missed. I think because of patients' lack of understanding and seeing the importance of why flossing is important. Flossing really helps keep our gums healthy, our tissues healthy, and really avoid kind of causing any future problems. And the other thing is making sure you come in every 6 months, right? We really have to help patients out and follow up with you guys to make sure everything is healthy and staying healthy. If you avoid coming to the dentist, then things are going to fall behind, and then they're going to snowball into something bigger, and we really want to kind of avoid that.
Yeah, I'm definitely guilty of not going to the dentist for a while, so I am one of those people. And you're right, people, including myself, are neglecting that part of their health. So back to what you were talking about flossing. What is the healthiest way to floss, the best kind of floss to use, and best practices for proper technique when it comes to floss?
Yeah, so as long as you floss, I think it's good. The best kind of floss, you really want to use something that's woven. The one that my assistant or my team likes right now is a trendy one. It's called Cocoa Floss. So it comes with coconut oil and has different kinds of essential oil, so it makes it smell a little bit better and is more appealing to the public. And so I'm in no way sponsored by Coco Floss, but I've seen great things from them. And so flossing in general is something that you need to do. Now, whether you use something that you find at CVS, Walgreens, it's not going to affect me really. But as long as we floss and make sure that we're kind of aiming it to our teeth and not just doing it to do it. What I mean by that is there is a technique to flossing. You really want to focus on your tooth's anatomy and kind of wrap that floss around the tooth and get into the sulcus and get deeper in there and make sure we're getting any plaque, food, whatever we have in there, living in there, out of there.
That's great. That's great information. Thanks for that. I don't think anybody's ever really taught me how to properly floss now that I think about it.
Yeah.
So I think it's an important technique that people need to learn for everyday health. So what is the cause of bleeding gums? Because I know I read online that that's kind of one of the biggest problems that a lot of people have when it comes to flossing.
So with bleeding gums, it is a sign of inflammation and gingivitis. And so it's kind of that we're leaving plaque and tartar behind. And so that's one of the biggest and quickest and earliest ways we notice that patients aren't really doing the proper home care that they need to. And so whenever you see bleeding, things like that, your gums might not be happy with you. And so you need to make sure that you're following up in those areas, kind of making sure that they're getting back to health.
So gingivitis, that's what the disease is called?
Gingivitis is the inflammation of the gums.
Okay.
And yeah.
So what does that lead to down the line if it isn't taken care of?
Yeah, so if you leave gingivitis alone with the inflamed gums, we start to see where we have bone loss, and that leads into periodontitis, where there's more room for those bacteria to live. You require a little bit more help. You need to get a cleaning every 3 to 4 months rather than 6 months, things like that. It just keeps building on itself. And so if you can, I would recommend that you take care of it every 6 months. And so that way we don't get down that road.
Yeah, that way you don't have to come every 4 months. So you can save a lot of money and a lot of time just by taking care of yourself.
So just routine work will help you make sure that you don't have to spend more and more and more money.
Awesome. What can somebody expect when they come to the Tooth Experience here in Edmond?
So at the Tooth Experience, we are a little bit of a smaller office, but what we kind of focus on is making sure we're focusing on the patients, right? I think a lot of dentistry is turned into a business, and so it's all about turning over patients. Whereas at the Tooth Experience, we really focus on the patient. We like to sit down, talk to them, get to know them, and make sure that we are doing what they first off need but want. So we want to make sure that we're gearing our treatment to what they're needing and wanting.
So what do you think is the most common issue that your patients complain about when they come to your office?
So I think the most common issue is that patients will come in for a routine checkup, right? And we see things on x-rays and we kind of point them out to the patient. But one of the problems I always get, or the complaint I always get, it's not hurting, doc. Well, it doesn't have to hurt for it to be an issue. If you go to the heart doctor and they say your artery is clogged 75%, you're not just going to sit around till it clogs 100%, right?
No, you got to do something about it.
Yeah, so we can't wait till the pain starts. We really need to make sure we're taking care of it, taking the proper precautions, and taking care of it when it needs to be taken care of.
So, yeah, I think that's really important. That it doesn't hurt, doc, doesn't necessarily mean that there's not a problem. And it's important that people go to the routine checkup. So let's say I lived in the Oklahoma City area. How would I book an appointment with you guys for a routine checkup or just to get started being seen by you?
Yeah, so Sheik, we are happy if you just give us a call. You can also go to our website and book an appointment directly on there. But whatever way you choose, just reach out and we'll try to help you out best we can.
Awesome. I just wanted to ask that while we're in conversation here, in case some of the viewers don't get to watch this all the way through, they have a chance to know how to get a hold of you. So back to some of the questions that I had when it comes to dentistry. What is the craziest thing you've seen so far?
Yeah, so throughout dental school, we get to follow around oral surgeons and go to the hospital and see some of the crazier things. I've seen some patients where they were doing reconstruction surgery and things like that.
Oh,
and so
wow.
I got to stand in on that, and that was pretty cool, man.
Wow, that's crazy. So like their whole entire like.
Yeah, so in some patients, and this is more of an orthodontic and oral surgeon thing, but sometimes when they're developmentally, their jaws don't line up properly, it can cause some TMJ and things like that.
What's TMJ?
TMJ essentially is the joint that the bottom jaw sits in, and so a lot of patients can't, well, I shouldn't say a lot of patients. Some patients can have issues with the joint and the way the joint and the disc move. And so they live with some chronic pain and things like that. And so sometimes we can create some splints or do some minor and less invasive things to kind of help them out. But sometimes it has to be the more invasive things where they have to go in and kind of make things into alignment and help out our body and put it back in place.
Wow.
Yeah.
Crazy. So I kind of want to talk about cavities.
Okay.
Mom tells you, don't drink too much Kool-Aid, you're going to get a cavity. Yeah. Mom tells you, don't eat too much candy, you're going to get a cavity. What exactly is a cavity? Isn't it like kind of like a hole inside your tooth? I don't really know, so I'd like to know.
Yeah, so Sheik, what a cavity is, right? We have a lot of bacteria living in our mouth, and we need to brush to kind of help get rid of the bacteria, but the main thing is we're getting rid of the sugars that these bacteria eat. So when the bacteria are eating this sugar, they're releasing an acid of sorts that kind of eats into our teeth. And when the acid builds up and it softens and eats up the tooth, that's when the cavity is formed. The word cavity itself means a hole. So yeah, you're absolutely correct. A cavity in this sense is where that acid is causing a hole in our tooth and kind of eating it away.
So was Mom right about not drinking the Kool-Aid?
So the thing with the Kool-Aid is you can enjoy your Kool-Aid and all that. The main thing is getting the sugar source away from the bacteria. And so the best thing for that is to make sure that we're brushing after we have a sugary substance, whether that be breakfast, lunch, dinner, or just a snack in between. So just making sure we brush and clean up things really well will make sure that we stay away from cavities.
So how much brushing is too much brushing? You know what I mean?
Yeah, so that's a good question.
Where like to the point where it's like, okay, like you might be actually doing some damage.
Yeah, and so I do have some patients that I see, and funny enough, it's usually like the older generation that they were always taught to brush really well, and so they like that harder bristle toothbrush.
Oh yeah, I remember growing up. It's like you got to use a soft toothbrush.
Yeah,
you can't use a hard toothbrush. Is that true?
Yeah. So the harder toothbrush is a little bit more abrasive on our teeth, and so it can cause damage. And you're absolutely correct. There is such a thing as doing too much brushing. So I would normally recommend 2 to 3 times a day. Try to do it after meals. That's where the 3 times a day, breakfast, lunch, dinner, kind of comes in. But you want to really make sure you're doing a good job keeping things clean. The newer electric toothbrush, I think, plays a good role in that. They do have kind of a sensor nowadays to kind of help us make sure we're not brushing too hard and things like that. And so that's where I usually recommend the electric toothbrush, because it's almost dummy proof, whereas the older traditional toothbrushes you can cause some damage with if you're brushing too hard and things like that.
That was going to be my next question, whether somebody should use like a traditional toothbrush that you get at the store, or if they should use an electric toothbrush.
Yeah, so I like the electric toothbrush because nowadays the technology, they have AI technology in these toothbrushes.
What?
Yeah, really? Yeah. And so you can download the app with the toothbrush and it will actually tell you if you're missing spots.
That's crazy.
And it even allows us to go into the app and put in spots that you need to focus more attention on. And it has a timer. So like it is making sure you're keeping your teeth clean. I'm in no way salesperson for these electric toothbrushes, but they are really cool and they're helping patients out there making sure we're keeping things clean.
That is cool. I mean, it's crazy how technology has advanced so much to where we got computers in our toothbrushes.
Yeah, exactly. And so it's crazy to think of what's going to come next.
That was kind of what I was going to ask you. What do you see like coming next as far as technology when it comes to dentistry? Any kind of new innovations that are happening within the industry?
Yeah, so dentistry is an always growing profession. There's no way for me to know where it's going to go, but the newer technologies are now going to 3D printing, 3D scanning, and things like that.
I saw that. We were in your office earlier, and he had like a tooth, I guess it was a mannequin.
Yeah.
And he literally took the 3D printer and went around the edge, and it was very simply, and it was projecting an image, three-dimensional image of the mannequin on the computer. I thought that was insane.
Yeah, so the computer takes the pictures that it takes of your mouth and kind of creates a file for us, and then we can even print just your mouth and have you hold it and take a look at it. We can make adjustments to anything we need to make adjustments. We can make crowns, we can make night guards off of that. And so that's one of the newer technologies. The other thing I have been seeing around, and it is started in California, but it's this new water pick looking thing, and it essentially has 60 little jets that it's going to propel water into your mouth and kind of help you when you don't want to floss.
It's a lot of us.
Yeah, and so
is that going to be like a consumer product that people can purchase?
It is a consumer product. We don't sell it here in office. You have to buy it directly from them. The step that it's going to require us is we do have to take that 3D scan that we just talked about of your mouth and send it to them. That way they can make a custom mold of it. And that way, whenever you get it, you just have to bite down into it and just press a little button. And in 7 seconds, it takes a whole like tub of water and flushes your mouth out with it. And so there are a lot of new cool little things coming into dentistry. And so it's always fun to learn about them and kind of show my patients where we can get with technology.
Yeah, that is cool. The 3D thing was crazy.
Yeah.
I remember back in the day having to bite into, I don't know what it was, but it took like a map of your teeth or whatever.
Yeah, so back in the day, they put that goop in there.
Yeah.
It went everywhere, made a mess and everything. And
no longer are the days. Things have changed.
And a lot of patients have trouble with that, and they have gag reflex, and that brings that on. So this new scanner, I think, is going to be great.
So earlier we were talking a little bit about cavities. Besides kind of brushing and good dental hygiene, what are some other things that we can do to prevent getting cavities and prevent procedures related to those, so we can not only save money but take care of our health better?
Yeah, so the first and foremost is you really want to follow up with the dentist as recommended. And so some patients might be 6 months, some patients might be 3 or 4 months. But the other things that you can do at home is use the mouthwash. When you're chewing gum and things like that, do sugar-free gum, things that have xylitol and the kind of artificial sweetener.
Yeah, I heard gum is the worst for it.
So yeah, gum is good and bad, right? It helps with the saliva, but we want to make sure it's sugar-free so that bacteria isn't eating the sugar and whatnot. So,
Doc, I really appreciate you sitting down, taking some time with me to kind of talk about some of the things I was interested in when it comes to dentistry. Maybe one more time, tell the audience how they can find your practice and book some time with you and your team.
So Sheik, first and foremost, I want the viewers to kind of like and subscribe our page, and so
definitely
follow up on that. But you can always reach out to the office. Our number is 405-348-9911, The Tooth Experience, or you can follow us on the website. I think the link is posted below. Just go on there and book yourself an appointment, and we'll be happy to see you.
Right on. Thanks, Doc. I
Thanks,
appreciate
man.
it.